Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great.
Good.
Great. Jordan, how are you?
I'm good, thanks. So most people probably don't realize that there's usually more than one type of tummy tuck, each designed to kind of address the different areas of the abdomen. We briefly touched on it in our Mommy Makeover episode, but I wanted to dive in deeper about it. So if you could please explain each type of tummy tuck and who's a good candidate for each.
Sure. So in general, the goal of a tummy tuck is to remove extra fatty tissue, which we all want, but more importantly, to tighten the skin. And everybody's different. People have different types of tummies. Some have a lot going on below the belly button. Some have things going on above the belly button. So a tummy tuck can be tailored to each individual based upon where their extra skin is. So there's something called a mini tummy tuck, which is probably the most simple tummy tuck, which just involves tightening the skin below the belly button. All tummy tucks generally involve an incision very low, below bikini bottoms, below underwear, and generally the incision goes from hip to hip. So a mini tummy tuck will tighten up everything below the belly button, and it leaves the upper abdomen alone. A full tummy tuck, a standard tummy tuck, is probably the most common tummy tuck that we do. That also involves that bikini line incision from hip to hip, but it also involves a little incision inside the belly button, and we tighten up the entire abdomen, really from the pubis all the way up to the rib cage. Most people honestly need that sort of tummy tuck. And then there are other types of tummy tucks where we literally go all the way around the body. We generally would call them extended tummy tucks. Sometimes the incision literally goes the circumference of the body, designed to, again, be hidden beneath bathing suits and bikini bottoms. That extended tummy tuck also takes care of loose skin kind of around the flank, the outer thigh. So it essentially is a tummy tuck combined with something that we would call a thigh or butt lift, believe it or not. So the terminology is a little confusing, but it really is, the goal is to tighten up the entire trunk, the entire abdomen area.
Okay. I've also heard of something called a reverse tummy tuck. Is that?
Sure. So a reverse tummy tuck is a tummy tuck that involves an incision below the breast. So instead of pulling down, so most tummy tucks pull downwards towards your feet. Mm-hmm. A reverse tummy tuck pulls upwards, and we kind of hide the incision below the breast area. And that's real good for people with a lot of loose skin in the upper abdomen area.
Okay, yeah. So it would be for someone who needs it above the belly button,
above
correct?
The belly button,
okay.
Yeah.
Okay. And so is this performed under general anesthesia? Yeah,
so I think most tummy tucks generally require some anesthesia. Mm-hmm. I guess a tiny little one might be something we could do with local anesthesia, but you're probably counting on having some anesthesia with that.
Right. And the recovery time, is that different depending on the type of tummy tuck, or is it pretty straightforward?
Well, I think most tummy tucks, there's some pain involved. You're probably going to take some pain pills for a few days. And there's a bit of recovery. You're probably going to be avoiding strenuous and vigorous things for 3 or 4 weeks. The one thing we do, or the one thing we have the ability to do with a tummy tuck, is tighten up the tummy muscles. So we haven't mentioned this, but most women who have a pregnancy, to some extent, the muscles get stretched out. So the muscles are held in place. That six-pack muscle is held in place by something called fascia. And I think every woman that I've seen who's had a pregnancy, that fascia stretches. So some of the roundness of the tummy, it's not just fat, it's not skin, it's muscle stretching. So during a tummy tuck, we have the ability to actually tighten up that fascia to get those muscles back to where they were before we all had kids. And so by repositioning those muscles, it results in some discomfort afterwards. So for that reason, in general, tummy tucks have maybe a bit more recovery compared to a lot of the other things we do in plastic surgery. So, you're probably going to be out of the gym for a good month. You're probably not going to be doing strenuous things for, 3 or 4 weeks.
Right. And usually it is a good procedure for someone who has had kids. Do you recommend them doing it after they've finished having kids?
Yeah. So in general, yes, because pregnancies ruin those tummy muscles. So if you're going to have more kids, it's probably best to wait.
Right.
Yeah.
And what sort of cost are patients looking at for these procedures?
So there's a whole variety of tummy tucks, to throw out some general numbers. You're probably, for a smaller tummy tuck, you're probably looking at something like in the $7,000 range. Some of the larger tummy tucks, are approaching the $10,000 mark.
Right.
And it really kind of depends, what we need to do.
Yeah.
Yeah.
And generally, a standard tummy tuck isn't covered by insurance, correct?
Right. So, good question. Generally, no. So generally, tummy tucks are considered to be a cosmetic, non-insured procedure. Sometimes for people who've lost a lot of weight and have a lot of hanging skin, sometimes an insurance company might become at least partially involved. But you have to have a lot of skin, and generally, a good guide there is if you're looking at your tummy in the mirror and if you can't see your pubic area, there's a chance that an insurance company might become involved if the skin's hanging down that far. Yeah.
Okay, great. Did you have anything else to add today?
No, I think that was a good cover
All right.
of tummy tucks.
All right. Well, thank you so much.
All right. Thanks, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.